Hi. So today our topic is going to be cytokines. Cytokines are basically molecules that are produced during times of inflammation, and they are divided into their functions and tasks. So first of all, we have pro-inflammatory cytokines. So first one is going to be interleukin 1. Interleukin 1 is mainly responsible for the fever that you see during inflammation. So the way it works is that interleukin 1 increases prostaglandin E2 concentration in the hypothalamus, and it does this via cyclooxygenase induction, right? So it works in the hypothalamus and it induces cyclooxygenase activity to increase prostaglandin E2 concentration, and that increases the set point for temperature, and that leads to your fever. Next, it is important for inflammation, right? It is also responsible for your osteoclast activation, especially in the setting of cancers. So what happens is that cancers which metastasize to bones leads to an inflammatory condition which increases cytokine production such as interleukin 1. This activates your osteoclast by increasing rank L expression, which is helpful in resorbing your bone, right? And that leads to the hypercalcemia that we see in patients who have cancer. So metastasis leads to hypercalcemia by cytokine production in the bone. Next, it is also responsible for upregulation of adhesion molecules. So VCAM and ICAM are an example, right? So these are important for neutrophil chemotaxis. Next, you have interleukin 6. Interleukin 6 is responsible for the formation of your acute phase reactants. Acute phase reactants are proteins or molecules that are formed by your liver during times of inflammation. So one such example is CRP, which is C-reactive peptide, and this is done to measure whether the patient is going into inflammation or not. It's a very non-specific marker. Next, you have fibrinogen. Fibrinogen is a procoagulant molecule, right? And it is very important in the case of aggregation, of platelet aggregation. So this is what goes on. This is one platelet and this is another platelet. In order for them to stick together, what happens is that they have these receptors which are known as glycoprotein 2b3a or GP2b3a. And on the other platelet, you also have this same molecule, this same receptor, which is GP2b3a. Now, in order for them to connect to each other, fibrinogen molecule connects them via this receptor. So this is the function of fibrinogen, right? And this is the process of aggregation. Next, you have hepcidin. Hepcidin is important for your iron regulation, right? So what it basically does is that, let's say that this is your enterocyte, okay? So this is your intestinal epithelial cell, and what it does is that it absorbs iron and then it sends it out into the blood. Now, what is important over here is that there's a certain molecule at this part of the enterocyte. This is known as ferroportin. Now, what happens is that if this ferroportin is present, the iron levels in the blood will be normal. But hepcidin is a molecule, right? It inhibits this ferroportin. Now, obviously, if you inhibit the ferroportin, that means the iron will not be absorbed and you will have an iron deficiency in the blood. That makes sense, right? So now what happens is that iron is important for your hemoglobin, or basically your red blood cells. And if you don't have hemoglobin, and so that basically means you are anemic or you have anemia. And this is the reason why in prolonged inflammatory conditions or in autoimmune disease conditions such as SLE or rheumatoid arthritis, where you are in a state of constant inflammation, you have increased production of these acute phase reactants, especially hepcidin. And because you have increased hepcidin, you have decreased iron in the blood. And that leads to anemia of chronic disease, okay? And that is really high yield. All right, next, you have TNF alpha. TNF alpha is responsible for the septic shock. What happens is that in septic shock, your endothelial cells, they contract in response to TNF alpha. When they contract, you have increased vascular permeability, right? And that leads to decreased systemic vascular resistance, and that leads to a decreased blood pressure and hence the shock that we see in patients. Next, it is important that it maintains granulomas, and this is very high yield because certain drugs which are known as TNF alpha inhibitors, right? What they can do is that if you have, let's say, TB, right? Tuberculosis. So we all know that for tuberculosis, granulomas are very important, and maintaining the granulomas is also very important because let's say if you don't form your granulomas, right? Why? Because you are using a TNF alpha inhibitor. So if you cannot maintain your granulomas, so the TB infection can spread and it can eventually lead to death. So the high yield point is this: TNF alpha inhibitors such as etanercept, infliximab, adalimumab, right? What they do is that they decrease TNF alpha. Now, before we give these agents to a patient, we always want to check whether that patient has an underlying TB infection. The reason being because that TNF alpha that you want to inhibit is possibly maintaining the TB infection and it's not letting it spread. So obviously, if you decrease TNF alpha, the TB infection can spread and it can eventually be very dangerous and can lead to the death of the patient. Next, it is also important for upregulation of adhesion molecules like interleukin 1. So these three cytokines, interleukin 1, 6, and TNF alpha, they are the cause of fever and sepsis that we see in a patient. Now to the high yield points. TSST1, which is from Staph aureus, and exotoxin A, which is from Strep pyogenes. These are known as super antigen toxins. Now what do? So they bridge MHC2 on the antigen presenting cells with the T cell receptor on the CD4 positive T cells. This activates your T cells and it releases a very high amount of cytokines or a large cytokine storm that leads to a septic shock, right? So this is what happens. This is an antigen presenting cell, right? And this contains your MHC2. Let's say this is your MHC2, right? And this is your CD4 positive T cell, and this is your T cell receptor. Now, what the super antigen toxins such as TSST1 or exotoxin A do is that they bridge this gap. This is where they act, right? So this is your TSST1 or exotoxin A. This is where they act. And when this bridge happens, a very large amount of cytokines is released by the T cell, and that leads to septic shock. This is how Staph aureus and Strep pyogenes cause sepsis. Next are cytokines that help with T cell growth and differentiation. So the main one that is responsible for the T cell proliferation and activation is going to be your interleukin 2. Interleukin 2 is responsible for T cell proliferation, and it also activates your natural killer cells. And because it's such a potent activator of T cells, it is also a target of many immunosuppressant drugs that we use, right? So in patients who have autoimmune disease conditions or in patients who have a transplant, right? You want to suppress their immune system. So what do is that you decreased in interleukin 2. So drugs such as cyclosporin, tacrolimus, your corticosteroids that you give, they all work to decrease interleukin 2 by different mechanisms, surely, but the main point is that they decrease interleukin 2. Next, you have interleukin 12. Like I've said before, macrophages release interleukin 12 that stimulates T helper 1 differentiation. That T helper 1 cell then releases interferon gamma, which is important for activating the macrophage, and that leads to epithelioid macrophages that hence form your granulomas, right? I'm going to go through this one more time. So this is your macrophage. Your macrophage releases interleukin 12, right, on the T cell, which is CD4 positive. This helps it to become T helper 1, and then this releases interferon gamma, and then the interferon gamma causes the macrophage to convert into granulomas. Now, a high yield point. Interferon gamma is responsible for the formation of granuloma, while TNF alpha is responsible for maintaining the granuloma. So these 2 points are also very high yield and important. Next, these are cytokines which help with B cells and antibody class switching. Now, the first one that you have to know is interleukin 4. It helps with class switching from IgM, right? So you know that IgM is the first class of antibody that you have initially. Then they class switch into IgG and IgE in the presence of interleukin 4. And interleukin 4 also promotes T helper 2 differentiation, right? So you have T helper 1, which is more responsible with the granulomas and macrophages, and T helper 2 is more responsible with your B cells. Interleukin 5 also helps with class switching, but it class switches to IgA, and it also activates your eosinophils, right? And it is also responsible for differentiation of B cells. Finally, interleukin 13, it is not very high yield. These two are more high yield in my opinion, but what you can know is that interleukin 13 works with interleukin 4, and that helps with IgE production. Next, you have chemotaxis. So the one interleukin that I want you to know is going to be interleukin 8. And it is extremely high yield that you know that interleukin 8, and I have talked about this before, interleukin 8, right, C5a, and leukotriene B4. These are your 3 major neutrophil chemotactic factors, right? So if these are present at any site in your body, your neutrophils will get attracted to it and they will reach where they are. Okay, so these 3 are extremely high yield and I want you to memorize them. Next, these are your regulatory and anti-inflammatory cytokines. Now these are interleukin 10. This is secreted by your T regulatory cells that decrease your inflammation. So the way they work is that they decrease MHC2 expression and they decrease your pro-inflammatory cytokines, and they also suppress your macrophages. TGF beta is an anti-inflammatory. It is more responsible with the repair and fibrosis stage, right? So when your inflammation has ended, now it's time for repair of the tissue that was damaged during inflammation. This is what is important. TGF beta, transforming growth factor beta. And another point that I want you to know, so for fibrosis, obviously we will need fibroblast, right? Very straightforward. So in order for activating the fibroblast, you need TGF beta, right? So this is important for activation of fibroblasts. Finally, we have hematopoiesis, right? And bone marrow stimulation. The only interleukin that you need to know is interleukin 3. Interleukin 3 acts on the bone marrow and helps with differentiation of the different kind of cells and basically increase production of immune cells.